My definition of magnet is a designation that helps differentiate us from other hospitals.
Magnet Recognition Program is the highest international award for nursing excellence.
And we didn't want to just manage the care, we wanted to drive the care.
And there are less than 6% of hospitals in the country that have achieved that designation.
Our nurses have a say in how they provide care to our patients.
The communication was always good. We have an excellent staff, so it wasn't that it was poor communication, it was just looking at ways to improve it.
And what we have found is that there are generally barriers in the process that prevent the nurses from doing what they need to do. So we now get feedback from the end user about what's working and what's not working.
Absolutely everybody within Denton Regional Medical Center is responsible for Magnet. It touches everybody.
From the young lady that empties the trash, to the volunteer that greets us at the front door when we walk in, to the physician that is Johns Hopkins trained, everyone fundamentally has a role in taking care of the patient here at the hospital.
And to me, that's Magnet in a nutshell. Everybody working together to achieve the best practices for patients.
And so there's nobody that's above that. You know, there's no one, you don't go high up enough where you're not trying to achieve excellent patient care.
We have a constant flow of ideas and solutions.
It allows you to really feel like you can make a difference.
Every morning we talk about how we can improve the services we provide.
Denton Regional's been on this path to excellence in the community for a long time. It's just now that we're getting recognition.
And I think being involved from our Magnet journey from the beginning, it was exciting seeing how just a few people at the beginning sort of adopted these new practices and ideas. And as we really got going, people began to believe in it, see that it was really working.
It was quite a bit of a commitment. It was one that we took very, very seriously.
The foundation for that journey really comes from creating an organization of collaboration.
We have different committees and different councils. We have a shared leadership model here where we take not just the leaders of the facility, but those frontline staff workers, and we get their input.
Moving towards this way of life for Magnet was important in the fact that it was going to change the entire model for care here at our hospital.
We've begun to really value the input that staff have, and not just value but seek their input, and that is our first response to a new process now. Let's see what the nurses think.
And we started out with unit-based practice councils on the nursing units, as well as the ancillary units, which makes Denton Regional a little different because a lot of organizations don't include ancillary departments as part of that shared leadership structure.
It's not uncommon for you to see an EVS worker, an engineering worker that's included in these discussions, because it really does take everyone to take care of patients.
Knowing that you have a forum to go to express your ideas and listen, and you have management listen to you, and that means that just keeps the ideas and solutions flowing.
Nurses give their concerns or anything that they may want to change or something that they could add to make policy or something better.
We ask questions. We make sure that it's evidence-based before we put it into use, and we make sure that we not just take the idea and run with it, but that we make sure we have the resources and that we have the processes in place and the education before we put anything in place and it touches our patients.
So it truly was a journey. Once you start down that road, you can't wait to see what's around the next bend.
It's just been amazing how everybody has started to work together, and we just changed our culture completely.
It is like a family here. Everybody knows each other. I mean, everybody introduces each other, and we know each other, and we're like friends and family, and we always are there to have each other's back, regardless of any situation it is.
You feel the energy when you walk through the doors, and it goes back to the relationships that are built here.
I'm working with friends instead of just working with coworkers.
When a friend asks you for that help, you're going to step in and help them any way you can.
Those relationships grew. So it was no longer Becky from ICU. It's just became your friend from ICU, somebody that you could talk to and have a good relationship so you could feel comfortable making those changes for patient safety, quality, or whatever the case may be.
When you're getting to be a part of the decision-making process and creating a end product that truly is the highest quality possible, everybody's happier.
Directors and managers promote extra certification for you to be well educated in where you work, well versed with what you do.
Well, I think anytime you have more involved employees, you're going to have more involved care.
What we did more fundamentally is change the way in which we take care of patients.
Every person is in charge of the patients.
And so for a patient to be cared for properly, they move through our system sometimes very quickly. And so the ability for practitioners to be able to communicate well back and forth, to be able to communicate care plans back and forth is critical to taking care of our patients.
The patient's experience is the whole hospital. They don't just experience the nurses, they don't just experience therapists, they experience the cafeteria, the restrooms, the way things look on the walls, and they make judgments based on that when they come in, how comfortable they are themselves being here, and then how comfortable their families are going to be.
We're all working together towards one goal, which is giving the best care possible to our patients.
There's nothing more powerful than that when you know you are doing the right thing and the best thing for the patient, and those patients are in our community.
Magnet talks to not only the hospital but to the community to let them know that the hospital stands for providing excellent patient care, that we have higher patient satisfaction, we have higher nursing satisfaction, and that we have better patient outcomes, that we're providing the best possible care to our patients and to the community.
I think the community sees this, that they are living in a community where they don't have to drive all the way to Dallas to get the best care.
If a friend were to ask, where I should go if I had this problem, I would say Denton Regional, because you're going to find, yourself the best doctors, the best nurses, the best hospital staff, and, you're just going to be well taken care of here.
We serve a community of people that we care about, that we're involved with directly, that are our families, and I want to have a hospital here just in the area that when someone in my family needs the kind of help we provide, I feel good about sending them there.
This distinction for Denton County is monumental. There are 4 hospitals in Denton County, and a host of other outpatient centers as well. We are the only one that's been designated as a magnet status. And so that means for the 110,000 people that live in Denton, the 500,000 people that live in our county, and the more than 700,000 people that live in our service area have a hospital to rely on that is ranked as among the top 6% in the country.
With Magnet, we've created a culture of excellence. It's not something that we are willing to give up.
Moving forward, we definitely will be taking our level of nursing care to a different level. And a different level, I mean by taking it to research levels.
Now I think we really can focus on doing our own research, which is very exciting.
They said it was a journey, and we're still on the journey. So we haven't stopped. The journey's still going forward.
Continue to focus on the things that are important to the community and make sure that we're providing the things that they need.
There's always more to go. Our goal is to strive for any, certification or any accreditation possible to make this place, our hospital, a better place to be for our patients especially, and for anybody that works here.
What's been interesting through this magnet process is that we've learned how powerful we are as a company when we work closely together.
There's no problem here at Denton Regional that is too big that we can't work on together, and that magnet designation and through Nursing Forum and shared leadership that we can't fix.
Just being here in this atmosphere where there's a lot of support, a lot of care, makes you feel like you're at home.
I actually pass 3 hospitals on my way to get to Denton Regional every day. I love it here. It's a family, and on top of that, it's a facility that's committed to giving the best care you can give to your patient. You can't beat that as a nurse.
It's very satisfying to go home knowing that we get to work with friends every day and serve the community that we live in.
It's who we are and what we do.
And it's a place nurses want to be, and it's a place that patients want to be.
There are over 6,000 hospitals in the United States.
Only 393 have achieved magnet designation.
And we are the only magnet hospital in Denton County.
That's why we are more than a hospital.
We're care you can trust.